Hi, my name is Lisa Selvage, and my helper today is my daughter, and I've given my consent for her to be in my video. A client was recently hospitalized due to an attempted suicide. Client placed a belt around her neck, insinuating that she was going to hang herself. Client has a history of out-of-control behaviors that include being defiant, breaking the rules, being argumentative, poor interactions with peers and siblings, disregard for school assignments, disrespect for caregivers, use of foul language, and making sexual comments to her fellow peers. The school has isolated her during her lunch period to avoid contact with fellow peers. Client is currently prescribed Risperdal 0.5 milligrams, 3 tablets per day, 2 times per day, Depakote 500 milligrams, 2 times per day, Adderall 10 milligrams, 3 times per day, and Clonidine 0.1 milligrams, 3 times per day. Adderall and Clonidine are medications used to treat ADHD. An antipsychotic used to treat bipolar disorder is the Risperdal, and Depakote is used to control the manic episodes related to the bipolar. This is my first meeting with the client. She is referred to me through St. Joseph Regional Medical Center. A psychiatric assessment was completed before the client was released from St. Joseph Regional Medical Center, and the client appears to be diagnosed with attention deficit hyperactivity disorder and bipolar disorder. I have spoken with the parents and received background information from them about the client and family history of mental illness. It appears that the client's mother also has bipolar diagnosis. I plan to begin therapy with the client, work with the client to identify problem behaviors, and formulate a plan of action to help the client deal with her feelings and behaviors. Hi, it's good to meet you. My name is Lisa. I'm a therapist, and my job is to help you figure out where your feelings are coming from and how they're affecting your behavior. My goal is to help you identify these feelings and behaviors and help you come up with a plan on how to adjust your behaviors to be more constructive.
Hi, my name is Bree. It sounds like this is going to be interesting at least.
I will try to keep our meeting to about 30 minutes each session. Does that sound okay with you?
That's better than I thought.
I'm glad to hear that. Today we are going to meet in my office. Follow me.
Okay.
Well, welcome. Have a seat.
Okay.
The first thing I want to discuss with you is confidentiality. Do you know what that means?
Yeah, that you can blab about anything I say to no one.
Well, that's sort of right. Confidentiality means that whatever things we discuss during our sessions stay between us unless I have your consent to release information to a particular person, or if you in any way insinuate that you're going to harm yourself or someone else. If you insinuate that you're going to harm yourself or you're going to harm someone else, I'm required to notify your parents, caregivers, medical professionals, or the other person. Does that make sense to you?
Yes, I get it. If I talk about hurting myself again, then you have to let my parents know so they can watch me like a hawk again. I get it.
What were you feeling when you placed the belt around your neck and insinuated that you were going to commit suicide?
I was just tired of being yelled at by everyone. I was just tired of feeling like I couldn't do anything right.
Sounds like you felt hopeless. Can you give me examples of what you were being yelled at for, or why you felt like you couldn't do anything right?
My parents don't let me go anywhere. They always nag me about doing my schoolwork. Always ground me because I get in trouble at school. I try to talk to them, but they never want to listen. They think that they have all the answers, just like teachers at school.
It sounds like you feel that your parents are overprotective, where they don't give you enough space. Am I hearing you correctly?
Yes, they're always on my ass about something. Nothing I do is right or good enough. They just don't understand me at all. I feel like I'm a total screw up. They won't even listen to what I have to say.
Sounds like that frustrates you.
Yeah, well, I'm tired of the bullshit. It's just the way of life.
So from what I hear you saying, your parents have always been like this. Can you tell me more about the situation with your parents?
Well, they argue a lot. It seems like they are always yelling at each other. My mom, she suffers from bipolar disorder, as well as she has a lot of manic episodes. She has been on several medications and nothing seems to help. My dad gets frustrated with her because she spends money without paying the bills first, and she tends to forget about the things she's supposed to do. Then, for days, she's in bed.
Sounds like it's also very difficult for you when this is going on.
Yeah, I guess so. After all The doctor at the hospital said that I have the same thing as my mom. I guess my dad hit the jackpot with us, huh?
I hear the disappointment in your voice. It must feel frustrating knowing that you are bipolar just as your mom is and seeing how it affects her daily life. Do you know anything about bipolar disorder?
No, not really. Just that it screws up your life and your family, and that everyone seems to stay pissed off at you.
I hear the frustration in your voice. I want to tell you a little bit about it. Is that okay with you?
Yes, please. You're the first person that wanted to take this time to do that.
Well, I'm happy to. Sometimes dealing with a disorder is easier when you know what it is and what to expect. Bipolar disorder is caused by an imbalance in the neurotransmitters located in the brain. It is often affected by environmental factors. This disorder often runs in families, and the onset can occur at different ages. Symptoms include shift in mood, energy, thinking, and behavior. Shifts in mood can last for days, weeks, or months at a time. These shifts can impair your ability to function on a normal level. The good news is that it can be controlled with proper medications, therapy, and support from friends and family. There are also things that you can do to help yourself with this disorder. Exercising, sleeping regularly, keeping stress levels low, and monitoring your moods can help. This is going to be a process that you have to work through your entire life. Just because you feel better doesn't mean that you can stop taking your medicine or stop therapy. People that stop doing these things often relapse, so to speak. Does that make any sense to you?
Jeez, I had no idea. Thank you for taking the time to explain all of this to me. I now understand why Mom acts the way she does. I also understand why all this means for me.
It's my pleasure. It's my job to help you understand and to help you guide you through this process. Earlier you mentioned that you were having some trouble at school. Would you like to tell me about what kind of trouble you're having?
Well, I have trouble following the rules and listening to my teachers. I also have trouble getting my assignments done. The other day I had to move in the lunchroom, and now I have to eat by myself because I said something that I shouldn't have said to one of the boys.
Seems as though you feel bad about these behaviors. Do you ever think that there are any particular reasons why you do these things?
I don't know. It's like I can't help it. I can't focus to complete my assignments because I just feel like my mind is going 100 miles an hour. And when I say stuff to other kids, well, it just comes out. I can't stop.
You sound frustrated. You also sound as though you wish things were different. Is that right?
Yes. Yeah, I do. I wish I could change things. I want to make it easier for my mom and dad.
Sounds like that you feel like your behavior is negatively affecting your parents and you want to make a change. Is that right?
Yeah, you're right. Now, that is how I feel. I want to get this bipolar disorder under control, and I want to be able to change my behavior.
I think that's great. It takes a lot of courage to be able to verbalize that. You're doing a great job of expressing your feelings.
Thanks.
We are running out of time for this session. I feel that you have made a lot of progress today. Do you have any questions?
No, I cannot think of any.
Okay, well, until our next meeting, I think that you should monitor your moods and maybe track any changes that you notice. You may want to note the time of day, where you are, and what you're doing so that we can identify any triggers. Does that sound reasonable?
Yeah, I can do that. Can I just track it in my phone?
Yeah, that sounds like a great idea. You may also want to keep track of the hours you sleep per night. That way we can see if you're getting enough sleep each day.
Okay, I can do that too.
One last thing. Make sure that you take your medications every day as the doctor prescribed it.